Okay, so we're going to do a little recap on our reline / rebase on the maxilla and soft liner on the mandible for this case. And I just want to go over a few things. Even though the case is trimmed and polished, I was able to fit it back on the articulator to go over some of the criteria. If you recall, I had some issues previously with the models falling off the mounting. So what I did, I put a plaster putty on the side. Obviously, I made a groove on the mounting and one on the model on each side. And so I was able to secure the case to equilibrate it. So having said that, I've equilibrated the case through selective grinding. So we need to restore the vertical dimension of occlusion into intimate centric contact. And after I did that, as you can see here, restored centric. The overjet is the same. And I think I've increased the vertical. Pin is touching on the incisal table. And I left the vertical open about 0.3 millimeter, which is really insignificant. That means I've reduced freeway space by 0.3 millimeters. And I didn't want to, could have kept going, but I was getting very close to having most of the anatomy on the teeth trimmed off. So I made a decision to stop there, which is within reason. Okay? Just going to go through some of the lateral excursions. Take the pin off for this one. So again, having the case articulated on a semi-adjustable or fully adjustable articulator enables you to restore centric and verify excursions. And as you can see here, I have good working contact on the right and good balancing on the left. And if we go to the other side, we have it there as well. And there. And if I undo both centric latches, and I can take this into a protrusive movement, and we have incisal contact as well as bilateral posterior contact. Very important that you have no interference back here. So that worked out really well. The maxillary denture, I was able to salvage the model by just simply prying the case off the model with a knife very carefully, after I equilibrated it, of course. Right? We do not remove cases from models before equilibration. Unfortunately for the lower, it happened to come off during deflasking because of the soft liner itself. But I did some preliminary trimming, as you saw in the earlier video, and I was able to place it in position to do my equilibration. So the upper one, as far as polishing is concerned, just going to pry that out. It's the same as before, same as polishing a new upper and lower case. Nothing has changed. The only difference here is, because you've added material on the underside, on the tissue-bearing side, while taking the impression, you might have increased the thickness of the palette. So what I did, I went in with a burr and trimmed off some of the acrylic from the top to give it that same uniform thickness of 2 to 3 millimeters, so it doesn't feel too bulky for the patient. Okay? And as far as polishing is concerned, some of the polishing materials that I used, my big rag wheel. You want to make sure that you have full, rounded, and smooth peripheries all the way around. eliminate any projections from the underside. And then I also used this here on the pallet with the pumice, and furthermore I used a small one to get in here. When you use this one, favor low speed versus high speed, so I use this a lot on pallets as well as on the outside here. Okay, the lower is slightly different. Before polishing this lower denture, obviously I used my big grinding stone to eliminate most of the material to get it close. And this is the hardest part to get it right. This junction here between the soft liner and the hard acrylic. You want to create a smooth transition. So I did most of the gross reduction with this wheel here, but then I went in even further with a soft liner burr, this one here, and I was able to get more of a finer finish all the way around. This works very well, you know, at least for me, the amount of pressure that I use, around 15,000 RPM, but you can play around with that, 15 to 20,000 RPM. And I used it a little bit around the periphery with 15,000 RPM, just to take away any possible little micro projections that you can't really see or feel, but this burr will take care of that. And I also use this burr to possibly eliminate any minor little projections that you might have on the tissue bearing surface. I used a cutoff disc on my handpiece, not the lathe, that I prepped with a narrow leading edge to again go in and define the Fresnel attachments. So once I did that, then I played around with some other burrs, my big egg burr, worked my way down to my smaller tapered burr. Even further, I used this little egg burr on the lathe. You can still use it on the handpiece, but I like it on the lathe, just to fine-tune some of the anatomy. And of course in here, whatever fits the scenario, whether you're using a big egg burr or a smaller tapered burr. And finally, for the polishing, it's no different than before. Just make sure that when you are polishing, especially near the soft liner, you're using the rag wheel and it's fairly wet, and your pumice is wet as well, so it doesn't create a lot of heat as you're polishing through this. So again, it's no different than before. This stuff is very resilient. You can sit there all day, you will not pumice the soft liner away. Don't think that if you have a big bulge here that you're able to pumice it away. You won't. It's actually more resilient than the hard acrylic. If you recall back here, you can clearly see there's soft liner material over the retromolar pad on either side. But if you recall, after I made my wax spacer and was able to fit the trimmed lower denture base back into the bite and between the wax spacer, I overbuilt this area to ensure that I had enough material here. Otherwise, if you don't overbuild your wax up before you process, you're not going to have enough material over the soft liner, and this will sort of look like this. If I can just pick a spot here, see this one here? You can see it. It's flexible, right? It's pretty flexible. It's okay to be flexible down here, but not up here. And if I could go back and do this again, I would probably use less wax spacer down here. So I got a little bit too high with my wax spacer in this area as well as in here. But I'm going to leave it because it's fine. It's just engaging the undercut. You can see there that it's engaging the undercut. So it worked out pretty well. If the vertical dimension of occlusion is kind of low, what you also might want to think is incorporating a reinforcement in here on the lingual side, like a braided wire. Because remember, you're taking 2 millimeters off the thickness of the base with a soft liner, and it makes it weaker. So you might want to think about incorporating a braided reinforcement in here of some sort. But overall, it worked out pretty good. So the beauty of the soft liner, obviously, when I tap into the acrylic, is rather hard. This will act like a little pillow, almost like a little cushion for the patient. This is ideal for patients that have perhaps retained root tips, multiple retained root tips, and you have severe undercuts. Somebody who has got a very low height as far as the ridge is concerned, so therefore usually the mental nerve around this area is very close to the denture base, and this helps. The downside to these, although this one is very good, some of them tend to be very porous and they tend to collect a lot of plaque and bacteria. So it's ideal for patients to get this periodically replaced. I would have them coming back on an annual basis, and possibly 1 to 2 years, somewhere around that time frame, they should get this replaced. This is not something that you can go for, 3-4 years as far as that's concerned. So that's basically the review for the soft liner on the lower, and if you recall on the upper, we did a rebase on one side and a reline on the other, but from the looks of things right now, you can't really tell. So the finish is exactly the same. And once again, if the existing denture bases do have discolored acrylic, you are more likely to do a rebase versus a reline, because you won't be able to match the color of the acrylic. So that takes care of the reliners, and I hope this was useful, and we'll see you on the next video.